few other things to mention about any type of biopsy, including a breast biopsy. What can you expect beforehand? So before the procedure, the images will be reviewed. You'll have a consent done with you. The most common risks of any biopsy are bleeding or bruising, and that risk is elevated slightly if you're on blood thinners or aspirin. Those things don't stop us from doing the procedure, but it changes the approach slightly. It makes us vigilant to small vessels around the place. And we also tell you that there's a possibility that you'll end up with a bruise as a result of the procedure. The second most common and most notable complication of any biopsy would be infection. Infection is very rare with biopsies when done correctly, but it is still theoretically possible. Even with perfect technique and cleaning and sterile preparation, there is always a possibility that bacteria that normally live on your skin and cause no problem get inside and cause an infection, in which case you'll have redness, swelling, you'll be uncomfortable, and you'll know that there's something not right. That will usually be treated with antibiotics. Those are the two most common complications. There are other rare things that can happen, like abnormal pain, the non-diagnostic sample from a biopsy, which is certainly worth mentioning, especially in particular cases where the lesions are small. Now, what you can experience after a biopsy is usually fairly mild, dull, aching discomfort. I usually ask my patients to have an ice pack on hand and use it 10 minutes on, 10 minutes off over the next few hours after the local anaesthetic wears off, which usually takes an hour or two if you're using short-acting local anaesthetic. Panadol or other over-the-counter pain medications can be useful. I also tell patients after having a breast biopsy that if you don't feel any pain or you don't feel very mild pain, you don't need to do anything. You can just let it settle down and the pain will go away on its own over the course of usually approximately 24 hours. That's what you can expect before and after most biopsies, including a breast biopsy.